Dr. Lum Lung, let's start with a basic. And can you tell me what is hospital level care at home? And as a physician, why is it that you see it as a critical option within healthcare?
Hi, Kelly. Thanks so much. Hospital care at home is really something that in the United States had not really been previously available until the last couple of years. This is something they've used successfully overseas for decades, but is fairly new here. And while there's a lot of healthcare going into the home, hospital care at home, we want to make sure people understand that's a completely different level. These are patients who, if we weren't there to provide that care, would need to be physically within the walls of a hospital because they're that sick. They're needing advanced expert medical care. They're needing a lot of interventions or diagnostics. And so we're now able to do that with the right clinical team and with the technology support. We can actually provide that care within the patient's home now, instead of them having to go through the difficulty of being in the hospital to receive that care. So it is care that is provided in the home, but at a significantly advanced level to what's being currently provided.
Right. Well, that is really fantastic for a myriad of reasons. And actually, while that in itself is certainly innovative and something new, certainly in the United States, Origin Healthcare is really something of what I would describe as a disruptor among disruptors, in that in addition to providing that important option to acute medical care, you are intentionally building a model that is focusing on the medical inequities between rural and metro patients. So can you tell me a little bit about what are those needs that you're so familiar with in Northern Colorado, where you're initially focusing this work?
A lot of healthcare innovation will sometimes start in the really dense urban areas for various different reasons, but the majority of the United States doesn't live in those same demographics or geographic footprints. And so we used our expertise of knowing the Northern Colorado area, where we have this nice mix of urban and rural communities, and tried to figure out how we could develop a healthcare system that met the needs of those unique patients in that population. And so this includes distance to healthcare. It includes workforce capacity issues in the hospital. And we really take a very hands-on approach. We have the experience of knowing the community here, having worked here so long, but this will be something that we know with the experience we've had the last couple of years and the outcomes that we've received, that we can do the same thing in other communities moving forward, that we bring our expertise, our operational platform, and we can now partner with those communities and really get to know what it is at their level that they're missing. Do they need clinical support? Do they need technology support? What is it that the patient population? We're really there to help support those communities. So not only helping the health systems that are there providing care, or perhaps bringing care to areas that don't have them. But then, of course, to the very important level of, being a clinician and why I'm doing this is making sure that patients now get the care that they need, that they don't have to drive hours to get care, that they have the resources where they can stay close to their support system, to their loved ones in the comfort of their home. So we're really expanding so much of when we talk about healthcare, we look at the numbers of what we already are seeing, but we forget about the absence of care. And there are a lot of people who don't get care or who wait too long to get care because of difficulties they have for social, economic, racial, ethnic barriers. All of those things need to be considered when we're looking at innovating care to be as inclusive as we're developing models as possible, and really to try to bring people into that healthcare system in a way that's meaningful for them.
Well, even here in this region of Texas, you have the fourth largest city in the country being Houston. And then you aren't, that far out before you're in rural communities, all within a similar service area for a lot of different industries. And so I can imagine that the model that you're developing has a lot of application in a lot of other regions around the country.
And we've taken an approach of being an independent group. There are health systems that are standing up hospital at home programs. We really feel that being independent, we can put the needs of the patient and the community first and really service and start from that as the foundation and be able to partner with the various health systems that are in the community, with self-funded employers who we know are struggling so much trying to get high quality care for their employees. So we can really provide that anchor community resource for all of the different stakeholders that are there because of that independent approach. And when we move to a different community, we're not starting from scratch. We're leveraging a lot of that learning and we're building that platform for shared data, for outcomes. And so we're going to be able to potentiate our impact every time we move into a new region.
Oh, that's exciting. Well, obviously communication is our thing. And so by mentioning the independent model that you've developed, how does that enhance communication with either the self-funded employers or the physician groups or any number of those different entities that would contract with you directly? I would think that there is some communication advantage for them. Am I right about that?
I think being independent and also being a provider-led group, we have a lot of accountability to the people that we're working with. We've been on the other side and we've struggled with communication. We've struggled with watching care be fragmented for not only the patients, but for the clinical team as well. So we have a deep understanding of not recreating some of those same problems that we currently see. And so direct communication with the people that we're partnering with, whether that's the patient's outpatient physician. Some of these self-funded employers have their own medical clinics. So for them to be able to get a hold of us directly. So we're really trying to bypass some of the more complicated routes of communication, both ways, bidirectionally, to really enhance that partnership and ultimately the care the patients are getting.
Thank you so much for the innovating you're doing in ultimately focusing on that region that you're beginning with and ultimately where it will take you.
Thank you, Kelly. And I'm so grateful to the support that your team has given us. And I look forward to collaborating more as we continue to grow and expand.
Great, thanks.